Hi, Dr. Joe Albano here today, talking about tennis elbow brace. So, first of all, what is tennis elbow? Tennis elbow is pain right over here on the lateral epicondyle, and it'll hurt you anytime you're grabbing, squeezing, twisting. It's just not going to feel good. So, I play hockey, and my right hand is my top hand, and I had this before, and it did not feel good when I had this condition. So, the other name for tennis elbow is lateral epicondylitis. The itis signifies inflammation, and that lasts for about 3 weeks. It then turns to a degeneration or a tendinosis, and so it is then a lateral epicondylosis, or the tendon that's involved mostly here is the common extensor origin tendon. That's what's involved. So, what do you do for this? It's always the RICE acronym, relative rest. So avoid aggravating activities. If you're playing tennis and that's how you got it, you have to decide whether it's bad enough to not play tennis. People will talk about the brace, and there's various things you can use, but mostly it's really a strap that goes around right over here, and it's just really tight. And the way it works is it prevents your body from pulling as much as it can on the tendon at the origin over here, and it really compresses the muscle down to achieve that. The problem is right there is a branch of the radial nerve, and I've seen people damage the radial nerve because they have this thing on too tight. So not a big fan of the tennis elbow brace. Other things people will talk about are steroid shots. If you've listened to any of my videos, you know I am not a big fan of steroids. They will damage the tendon every time you put it in there. I've seen people here who've had multiple injections of steroids and they have problems. So, first of all, the tendon looks really bad. I've seen even where the fat right below the skin is atrophied and pretty much gone right there, and they have a divot in the skin right there. Also, the skin can get discolored and it'll be white. So I've seen all of that with people who've had multiple steroid shots. Not ideal because, well, they came to see me anyway because it didn't fix their problem. Even if it helps, it'll only help for a small period of time, a day, a week, a month, several months if you're lucky. And then you have a worse problem than you started with. It's not a big fan. Surgery is rarely needed to help with this problem. The best answer for this, I think, is the regenerative injections. So OrthoBiologics, things such as your blood, platelet-rich plasma, PRP, your fat. Rarely do we even need to use bone marrow to help this, but really good regenerative options to help you with your tennis elbow problems. If you want to find out more about this, go to our website, albanoclinic.com, or give us a call. Thanks for listening.